You've heard my joke. Yes. Okay. And we're live. Thanks. We are live. All right. Good afternoon. We will call the Board of Health meeting to order. Welcome, everybody. Welcome to our newest member, Adrienne. In case you didn't know Adrienne, we are recorded. You can access all those online, and we broadcast live. It's really, I'm sure there's a lot of people watching. How many? Can you tell? None. All right. So just to let you know, we are being recorded, which is helpful because we can go back and watch the meetings later if you need to remember what we're doing. We will start today with public comment on items under the board's jurisdiction, but not on the agenda. Is there any public comment? No. All right, first item out the gate, discussion decision, election of officers. As you know, I am technically supposed to be a liaison and then have a functioning board. There are only 4 people right now, so it'd be great if we could find somebody else, just because having an even number is not always ideal. But on that note, I've been chairing the board for 2 years, so I think we're ready to have somebody else be a chair, and I will take an official role as liaison. Therefore, I move to elect Tiffany as the chair. Is there a second? Is there a second?
I'll second.
Okay, Adrienne will second. Good work, thank you. All right, there's been a motion and a second to elect Tiffany as the chair of Board of Health. Is there any public comment? Any public comment? No. Hearing none, all those in favor, please signify by saying aye.
If there is a priority at the hospital, we know where I have to be.
Well, that's why you have a vice chair.
I'm just spread the love.
And we'll make it work. Okay. All those in favor, please signify by saying aye.
Aye.
All those opposed, same sign. Motion passes. Congratulations.
Thanks, Lindsay.
You're welcome. All right, Mayor. That is yours now. And you get to take it away.
From the rest of the meeting?
Yep.
All right.
All you.
All right. So we need to review minutes from the last meeting and get approval from meeting minutes.
Oh, we need a vice chair.
Oh, we need a vice chair.
Yep. Sorry.
All right. Anybody for a nomination for a vice chair?
Who wants to be vice chair? It's not me. Because I'm just going to be a liaison. Adrienne, how are you feeling? Would be vice chair?
YOLO.
Okay. All right.
Welcome. Would be delighted.
Okay. Perfect.
Can I get a second?
I second that.
I didn't technically make a motion. I move to approve Adrienne as the vice chair.
I second that.
All in favor?
Aye.
Aye.
Aye. All opposed, same sign. Motion passes. Welcome.
Who seconded?
Alyssa.
Alyssa seconded. Okay.
And then do we have to fill any other positions or just those 2?
I think just those 2.
Okay.
And then daily services are admin, so we don't need a secretary.
Perfect. All right. So did everybody have a chance to review meeting minutes from our last meeting in January 26th? Can I get a motion to approve minutes for the January 26th meeting?
I motion to approve the minutes from the January 26th meeting.
Can I get a second?
I can't second anymore.
But she wasn't here,
I
so
wasn't
she
here.
can't
Am
second.
I allowed to second?
Keep it second.
I'll second.
Sure. All right. All in favor, say aye.
Aye.
Aye. All opposed, same sign. Motion passes. Lindsay.
Good job.
All right. Discussion of bylaws. Didn't we do that last time? Discussion and review of bylaws?
Nope, we forgot to put it on there.
I know. Oh, it's these ones, right?
Mm-hmm.
All right. So we have a proposed bylaws for the Broadwater County Board of Health that has been brought to the board and is available for comments. Anybody have questions, concerns with the bylaws as they stand? There's a one-page outlining the scope of the Broadwater County Public or Board of Health. Do I need to read all of them, Lindsay?
No, not at all. I mean, give everybody a minute. If you guys want to review them, we can, go a little longer for a minute and come up with any issues. In a perfect world, we all have time to sit down and review these in depth. But these have been looked at pretty closely the past year. Like last year, they were really scrutinized. So we'll just take a second, I guess, if that's all right, Madam Chair.
Sounds great. Any questions?
Is everyone okay with the regular meetings? So we have it listed as the third Monday every other month at 3 p.m. That is really like a minimum. We can have more meetings than that. It's not a big deal. We can have different days, and obviously if it needs rescheduled, that's fine, as long as we just notice it the proper way. If you want to keep that, you can keep that. If you think a different day is better for everyone, then pick a different day.
Yeah, I'm open to discussion with the date of the meetings.
Okay.
Wednesdays and Thursdays are bad for me just because the hospital's heavy.
So is Monday a good day for you?
Mondays, Tuesdays work well for me.
I prefer Mondays, yeah.
Okay, yeah. I think we leave the
Just leave it.
meetings as they stand.
Yeah.
If there gets to be an issue or a conflict, we can look at readjustments,
Yeah.
especially with it just being the four of us. And we just have to look for room times if we change it. So
Yeah, this room gets booked out for different things, but that's, that's not hard. Let's see.
are you sorry.
Pardon?
Are you good making a motion on these?
Yes.
Okay. Can I get a motion to approve the Broadwater County Board of Health scope of practice? Oh, bylaws. Scope of practice.
Motion to approve.
In a second. All in favor, say aye.
Aye.
All opposed, same sign. Motion passes to approve the Broadwater Board of Health bylaws. And then you need me to sign these, right?
Yes. Is that the scope? Yeah, that's the scope. That's the bylaws.
Oh, the scope. Well, it says bylaws on here. That's why I
Yeah,
was
that's
asked.
just the agenda, but this is the scope.
Okay.
I think.
Do we need to re-motion that then?
What's that? I don't think we
Just
need
needs
to
to be That's already been taken care of, we're just
Oh.
gonna have it signed.
Yeah, yeah, we'll sign that one. Like that's something different. The Board of Health. I don't think we need to re-sign bylaws, or should we? Now that I'm thinking about it, jeez, because we did sign them. Dealing. We've got them approved. Let's make a note that we've approved them, and I'll just bring it
Okay.
for us to sign next time. That's fine. If
And-
you.
And do we have an update for Megan from the county sanitarian? Or we'll review it the next meeting.
Yeah, she didn't send one, so I think that's fine. Let her enjoy her vacation.
And we'll follow that with the discussion for the silos also. All right, Ruby, that puts you up. Oh. So we have Ruby Taylor, Public Health Director.
Hey, thanks. I don't even have to introduce myself. So just general public health update. We're doing fine, nothing crazy. We still have some flu shots available, mainly the regular dose flu shots. So if you know of anyone who would like one or want one, they are good until June. So we can give them until June 30th. We just had our first highly suspect measles case. And right before I came, we got it back. It's negative. So thank goodness. The symptoms lined up, but the patient was fully vaccinated, so we weren't overly worried about it, but like very similar symptoms. So don't know what she's got going on, but one of those things. So that was good to hear, less to worry about. And yeah, it's pretty much just business as usual at Public Health. We're just chugging along. We're working on our plan for the bike rodeo this year. We're looking at maybe doing it in June instead of May this year. And I think we're looking at the second weekend in June. We've reached out to our typical partners, so Rotary and the hospital, to see if that would work for them or what they're thinking.
Okay.
And we also talked about maybe doing like a Friday evening to see if maybe we'd get more people that way. Like noon to 2 kind of thing. Or I guess Friday would probably be closer to like 2 to 4, 2 to 3, something like that. Just later in the afternoon so that maybe there's more people who can come and want to come instead of coming first thing on a Saturday morning. And then the other big one is I have a tabletop coming up. And if you guys are wanting to come to that, you're more than welcome. I have not sent the invite yet, but I will get it out. It's March 3rd, and I think it starts at 9 a.m., and we're going to be in the community room at the school. And it's a highly infectious disease tabletop, so they're fun. It's being run by the FEP team, and last year they did a phenomenal job, so I think it'll be just as good this year. And I enjoy doing those.
Yeah,
So.
we know I'll be there.
Perfect. I think that's it for public health, just general updates.
How do flu and COVID numbers look right now in the county?
Good, nothing too crazy.
Was the measles confirmed? Was it confirmed?
Negative, she's negative.
She's negative, okay.
Yep,
I missed that, sorry.
confirmed negative just before I got here.
Confirmed negative, okay.
Yep.
Thank you. Sorry, I missed when you said that.
Do you know is influenza A still needing to be sent out for subtyping
I am not
at
sure.
the county level? Okay.
I'm not sure. I would say if that's what your last notification was from state-wise, then continue to, but I have not heard anything different.
There's just been a little gap, so just making sure things are covered and followed through, because with the avian flu and all that subtyping. Okay. That's questions I got. Anybody else have questions?
I have a question.
Okay.
What do you do at the bike rodeo? Yes. What do you do at the bike rodeo?
So the bike rodeo is a requirement, not a requirement, but it's our injury prevention project for our FCMR grant, or MCH, the Maternal Child Health Block grant. And basically we teach bike safety, so hand signals, stopping, we do an obstacle course to test skills. And we do as much teaching as we can. So we usually have a gentleman who comes and does hand signals for us exclusively, and he's a motorcyclist, so he's got hand signals down pat. And then they have to go through the obstacle course and show that they remember them and learn them and all of that. We also provide, it used to be provided by, oh goodness, I can't think of the organization, but they used to bring free helmets to replace kids' broken helmets or to give helmets to kids who don't have them. They no longer exist. And so we took that on 2 years ago now, and we purchase and give out the helmets. So that's been really helpful, and kind of the main draw for a lot of people is to come and get helmets for their kiddos. And they're nothing super crazy by any means, but they're nice helmets. And then after they go through the obstacle course, they have to fill out an evaluation, and then after that they get a goodie bag and can kind of just go through the obstacle course again if they want. We kind of just have fun for the most part. Like, that's the main goal, is for it to be fun, but for them to also learn something. Oh, and we also have a group of gentlemen who check over the bikes for safety. And then we are typically able to give out, I think the last 3 years, we've done 6 bikes.
Okay.
So we do a drawing for those. And we do like a big kid, middle kid, and little kid bike, typically. And we do one for each gender, so.
If you can do any miracles on how you get your kid to wear their helmet once they're older.
We've talked about seeing if we can get like an ER physician or someone, because we partner with the hospital for their health fair. If we could get someone to come in and do some education on head injuries and the risk of head injuries in regards to bicycles, would be super awesome. But it's just never panned out for us, so we just try and
I'll see
push
if I
that
can wiggle
home.
something.
Yeah. I mean, even just like one of the ER nurses or something that would be willing to like throw in a personal experience here and there would be cool, but.
Yeah, we do try and partner. The hospital tries to partner at the same time as Bike Rodeo when we do health fair the same day.
Mhm.
So you'll see all of us together. You'll have the hospital there. We've been able to get the helicopter to land a few times and we'll do kind of a touch a truck with the helicopter, and the EMTs and paramedics are all there. We have like the chiropractor's office and clinics, and we've had we've had all sorts of people come to the health fair.
Last year, I
Fish and
think
Wildlife
PTA
has
was
been
there.
Yeah,
Yeah.
PT's been there.
Well, when you have your flyers together, send them my way. We will put them on the website.
Okay.
Yeah, we can do that.
Yeah, and so I'll look at that second weekend in June,
Yeah,
and I'll see if I can get you a provider. If not, I'm normally there.
perfect.
All right. Thanks, Ruby.
You're welcome.
Looks like you're here again.
I was like, I think it's
You
still
get
me.
to stay. So for discussion and decision on public health emergency plans policy reviews.
So basically, today what I think I would like to do is just bring you guys the idea that I'm having for how we can review plans and everything. I did bring my emergency transport plan for you guys to look over. This is basically the only one that is not 7 million pages to print, so I printed it for you. And then what I'm thinking is next meeting I will have a flash drive with my other plans on it for you guys to go over. And I'll give you each a flash drive with the plans so you can look at them at your leisure and all of that, because it's a lot. This one, I'm fairly confident we don't need to do any extreme edits on. The only thing that I think needs changed is I think the bureau chief has changed for the lab section. But everything else I believe is pretty well up to date. I went through this one pretty in depth 2 years ago now, I think, and updated everything, added locations for all of our testing kits and all of that. So we should be good on this one. The big one that I'm most concerned about going over with everyone is the communicable disease plan. So it's our pan flu and communicable disease plan. And that one has not been updated since I think 2019 or 2013 even. And it's like 60 pages. It's an absolute beast. It does not need to be 60 pages. Other counties our size are like 7. So ICS is not my strongest suit, so I am really relying on help on these ones. So that is the main one that I want to get on the flash drive for you guys, because I don't know exactly what we need in there, what we don't need in there, other than, like, because when I sit and read it, I'm like, well, we could use this. This is a usable plan. We can take this out and, like, follow it and get things done. However, ain't nobody sitting down in an emergency and reading 60 pages of a manual.
Yeah.
So, just having you ladies look at it with me would be phenomenal.
Is it more like story format versus bullet points? Is that
Yes,
Okay.
and it has stuff like, demographic information, like Broadwater County has 3,000 residents. Like, it's bizarre. I'm like, I don't know why I need to know this for this particular situation.
I mean, I think that needs to be part of a plan, but not that plan, because you need to know how many counties, people are in your county to be able to know what you potentially might have to treat maybe, but to have an individual plans that are specific.
It's
Seems
super in depth. Like,
Yeah, let's look at it.
it's wild.
Have you taken the FEMA 100, 200, 700?
Mhm.
Okay.
I just am not great at it. It's I don't have a ICS brain
Okay.
as much as some other people. I understand it. I enjoy it. I can work it. It's just not my strongest suit. So wherever I can get support on that stuff, I'm more than willing to take it.
I have a question.
Hmm.
What do you have to have? Like, what do you have to have for what they need for the state? Like, what do they? I mean, is there like, okay, these elements have to be in the plan, otherwise it's.
Yeah, so the checklist that we'll sign off at the end of reviewing the plan, and I have a checklist for this one too. I should have brought that, sorry. I will send you the checklist for this one, and I will put the checklist for each individual plan on that flash drive too, so that everyone has that for reference. But there is a checklist that's like, okay, this is here, this is here, this is here, and it's the checklists are still kind of convoluted in my opinion, but it gives you a solid look at what needs to be in the plan for it to be state level, like this is going to be a workable plan and okay for your community.
I'm wondering what, I mean, like, I get the flash drive, I think is a good idea,
Mhm.
because then people have access to that. But I know everybody has a lot going on, so if you're like, hey, can you all read 60 pages and see what's up? Do you have some guidance of like, maybe it's page 3, page 10, page 15, or hey, let's cut out this whole section, here's what I think meets the needs.
And that's kind of what I'm thinking too. I haven't looked at my Pan-Flu CD plan to just like tear things apart from it just yet. But I'm hoping by the next meeting I have that done at least, and I can tell you where and what I think we can take out. And then we can kind of just go from there as a group.
Yeah, 60 pages is just a really big document.
That's
to
a big
try and
document.
do here.
Well, you don't.
And it's
you're
so-
looking at it, you don't know what.
The way that it's broken up too, which is also why it's hard to print. This zip file that it's in is broken up into each section. So we can also take it by section and do like introduction one meeting, or like 2 sections, like introduction and this, and do that sort of thing. So when I get you the flash drive, I can show you guys how it's broken up on there too, so that because it is more digestible on the computer is the other reason I wanted to put it on a flash drive for you versus bringing you a paper document or emailing it.
Can you do it in a shared folder, like within Teams or something like that? That way we can make edits and it's all shared on one thing versus having flash drives that are all individual. That way we can work on it as a group together.
Yeah, you can try
Do you
that.
guys have access to Teams? Do you do Teams?
I do Teams. I'm unsure about the access for this in particular.
Might be if you create it and then she did a SharePoint.
You should be able to share.
Okay.
You can pick it up.
And then she could have access.
Yeah.
Let's trial that.
Yeah.
Versus flash drives, because I know I can't even put a flash drive in my work computer.
Okay.
So it would have to be home, which I don't mind. But I think if we could do a shared document, then we can each make suggestions.
Yeah.
And then, or each of us could take a section and break it up and make it more manageable.
Yeah, that's a good idea. I didn't even think about Teams or,
Yeah.
I mean, worst case scenario, I'm sure we could do like a Google Drive too, or Google
Yeah.
document that we can all edit.
I think having some direction for how you want to approach it. Like, I like the idea of how, I mean, either way, however you guys decide, but we're going to work on the introduction and this chapter, and then everybody can wrap their mind around that rather than.
Yeah, I think that's what we would do, is just take it by section versus, here, read 60 pages and tell me
Right.
what you think. Like, that obviously is not reasonable.
And you will know what can come out. Too. You know, like chapter 3 and 4 gone. I don't know if it's chapter 3 or 4, but just.
It
saying.
feels like chapter 3 and 4.
Yeah, just whatever needs done to have that guidance from you would be helpful.
Yes.
For the board.
So then you need board approval eventually for all of your policies.
Yes, but it's not quite as formal as like, essentially I just need you guys to look over them and make sure that we're all on the same page and that it's usable. But it's not, but also with the CD and the flu plan, since we're going to be probably making some pretty significant changes, like this one, I just need you guys to look at and be like, hey, looks good. But the one that we're making significant changes on, I believe that we'll need to like sit down and do like an actual approval on it.
And you've looked through this within the last 2 months and you know this works for you. This
Yes.
is like, you're happy with this policy.
Yes.
This one that you gave us.
Yes.
I think that would be the ask, is to have, at least you have reviewed them and they work for you, and your suggestions for edits before we tackle Giant.
Yes.
Because you're gonna be the subject matter expert when it comes to your department.
Yes. And this one I am still happy with. There's not anything crazy that needs changed other than, I think, now that I'm looking at it, I think that the Laboratory Service Bureau chief is different now.
Do you want the board to like take this, review it, email you that it looks good, or do you need something like official in the meeting?
I have a checklist for this one too.
Okay.
So I will email you guys the checklist.
Okay.
And as long as everything looks good on that, then at our next meeting, I will have you guys, we can vote on and sign it.
Okay. I'm comfortable with that. You guys?
Yep. That's good.
Do you want to try and send something in Teams beforehand so we know if that works by the next meeting, if we have to
Yes.
change gears?
Yes. Maybe I'll shoot for sending the checklist through there.
Okay.
Because I can also do the checklist as a DocuSign too, so that we don't have to do a physical sign. But DocuSign is sometimes a nightmare for me, so I would prefer a physical signed copy. But
Yeah, no. It gets stuck sometimes.
Mhm.
Okay. Anything else? Okay. Sounds good. Do you have anything else for us, Ruby?
I don't think so right now.
Okay.
I don't know if Confluence this year, if they're going to do another Board of Health training. But would any of you ladies be interested in that?
Absolutely.
Okay. I will look and see if I've got any info on Confluence for this year. And if I do, I will get it sent to you so you can get that sorted. And I believe the county will pay for registration for it, correct?
I think we should, yeah.
Okay.
Board of Health members are going as Board of Health members, then yeah.
Yes. So I will look into that and get that to you too, so that I can, because it was pretty helpful last year. I liked it. And that was their like inaugural course of it. So I think this year will be better even.
The training, on that note, and I don't think it comes, who puts on the Confluence?
Confluence is put on by Confluence.
Okay, there we go. So I've sent out, I think twice now, the trainings that I'm seeing, and I'm on that weekly news.
Oh yes, they have a. I don't know if you're right. They might. I think they switched it to an online format.
But I don't know if it's Confluence. Or if it's something more through DPHHS or something like that.
Which Confluence and DPHHS kind of work together.
Yeah.
So I think you're right now that you say that.
Just check the emails you've received from me,
Yep.
and it should have that links and the website on there. But they have a lot of good stuff that they're trying to do, and it's newer.
Yeah.
So I think
Yeah.
she's
Confluence
very
is like
oriented.
AMFO and Montana Public Health Institute and something else.
I think it's the Public Health Institute.
Yeah. So, yeah, I'll look into that either way, because if they have anything like in person, it's also nice just networking wise to like meet other Board of Health members, and then you have people in your corner that you know you can talk to and have game plans with if for some reason there's something that we don't understand. And then there's like Jim Bob over in whatever county that's been on Board of Health for 42 years and can help us.
Okay. Yeah, I know. I think it's worth going if they have it again.
Yeah,
That's good.
it was good.
and they had a whole Board of Health track, so there's other things going on, but they had it outlined specifically for Board of Health to follow a specific track, so.
Yeah, and I think it was just the one day for you, for Board of Health.
Yep.
But it's a 3-day conference typically, so. And last year it was in Helena, so it was super easy.
Good.
They might do Billings this year, so if you don't like Billings, sorry. It's a trek. All right. What else do we got today?
Madam Chair, I put down the round. No. I'm just telling you, the roundtable discussion is something we use in a couple of our other boards.
Okay.
And it just allows a little more free talk. I did put discussion decision on there. Should something need decided on, but really it's just, hey, these are topics for conversation, and then if anyone wants to bring up anything that's not listed, they can do it during the roundtable discussion.
All right. I like it. So roundtable, we have website, additions, links, announcements, etc. Can we pull that up on the for everybody to see?
It is not exciting.
It's not exciting.
And
This
like I
is
said,
Bob Campbell. He is public health medical director, right? Get all our terms right, just so you know. So Board of Health. Oh, look, it's already been updated from last month. Look at you guys go.
Okay. So that was me as the chair.
Well, last month though, but we
Oh.
added.
Oh, that's right.
Yeah.
Yeah.
So.
Okay, we'll switch that around.
Okay.
I know.
And then can we look at the resources that maybe we sent? Because this is all that's on our county website for Board of Health. So it's just basically the members, our bylaws, and like links, I think, to come to our videos, right? That's all that's pretty much on this.
Yeah. And we're a little restricted with, it's kind of, you get on the back end of it, and it's, they have like formatted boxes of how to put things in. It's better, much better than what we had. I have down, I need to work with Ken on what we could put on there, because we had discussed previously about updates, like the seasonal updates, and then events like the bike rodeo, and just doing some different things. So,
And do we have a Board of Health Facebook page for the county? Or social media
No, I don't
accounts?
believe so.
Okay.
yeah.
Where does that email go?
I was wondering.
Which email is it? I
We'll
can't.
click
Board of
here
Health
to email
email?
Board of Health.
Here? Because I
Yeah.
can't read that far away.
Yep.
Will you click it?
Click here to email Board of Health.
I have no idea.
Just click.
Click
Uh,
where?
Try
One of
Outlook.
those.
Try
Which
Outlook.
one? Okay, tell me how many
Up
down?
up one, right there.
Can you not see anything on the screen over there at all?
My astigmatism has gotten.
No. I mean, like, it doesn't
No,
pop
it's
up on
like-
your
it's
screen.
over
That's
there.
probably
It's
not
up to
here.
her.
It's like a
It's like-
third screen, not
Yeah.
like a duplicate of what she
Yeah.
has.
Oh, that's silly.
And I think you just go down to the right, bottom right, and say just
Yes.
I think.
Yeah, no, that wasn't anything about your eyesight, Miss Daly.
I don't think it does anything. Welcome to Outlook 2016. This is what popped up over here.
Okay, so here's what
Let
I'll
me
do.
see if I can do it from my phone.
Okay, I can check it. This will be my to-do list of checking all that. Check the email link.
Who would that go to?
That's why I'm like, is it like Board of Health at broadwatercounty.mt.gov? Because who has access to that? Or does it come to like the public health email? Or that's what I'm like.
It doesn't go anywhere, it looks like, at this point.
Okay.
I mean, it didn't come anywhere here.
I don't know that we should have that, because we don't want it to go to some ambiguous
Yeah.
email box. So really,
Let's get rid of that.
people can email or contact the members. I don't know. Yeah, I think we should get rid of that. Okay. Unless it goes to Daleen, since you're the admin. Congratulations.
It does go to
Admin.
Daleen.
Does it go to Daleen?
It goes to the environmental
Okay.
health.
Merry Christmas.
There's so many celebratory
really don't
events
get the
happening
whole
right now.
scope, right? All the emails that I get.
Oh my
Better
gosh.
you than me, because I'm really bad at that.
I doubt you will be inundated with Board of Health emails.
Well, now that everyone knows it goes to Daleen.
Yeah, well, true. If it's all right with you guys, website stuff, I kind of had a little checklist. I did not get to it in the past 2 weeks. So I will just ask Ken what we're able to do, what we're able to post, and how easy is it to change, because
I had you had asked for some thoughts in terms of what maybe could be added to that, and I spent some time putting those together, so it's appropriate for us to talk through those. Here, I actually printed it out because true nurse brain, if I didn't write it down, it never happened.
That's why I like set mine, and then I was like, I don't even remember what you said.
So I looked through, really overall, I kind of compared the 2022 Community Health Needs Assessment that was conducted through Billings Clinic, and also I reviewed the Lewis and Clark County one as well, just because they're border neighbors. Kind of wanted to see what they had. And there were 3 main areas that kind of were highlighted, specifically looking at the one for Broadwater County. But there were 3 areas that I thought maybe based on the needs that were identified in here that we could maybe look at or consider.
Yeah.
So the first one of the biggest areas is behavioral health and substance use.
Yep.
Is one of the biggest areas of concern for our county. So every section includes like the rationale, why this supports it, and then the suggested web content. And this is the very nice abbreviated version, not the total brainstorm.
Right.
That's like 6 pages long. I have that saved on a shared
oh my
drive.
gosh, good on you. Okay.
So like some of the suggested web content in terms of behavioral health is like what are local resources for both behavioral health and substance use disorders, crisis resources including the 988, what are the local ERs, all that jazz. How to get help, so like by situation where it's like a sort of a decision tree in terms of I don't have health insurance, where do I go? I need a flu vaccine, where do I go? I guess in terms of behavioral health and substance, I've got somebody in crisis or I'm struggling with depression.
Yeah.
That include not just our county, but some of the resources out of Bozeman, Helena, those areas. Plain language education on screening and early intervention, which was highlighted in the Community Health Needs Assessment as one of the lowest cost yet highest impact areas for getting treatment to the folks who need it.
Yep.
And then what are telebehavioral health access options? Because one of the bigger issues, especially when seasonal weather impacts people's ability to travel, telebehavioral health is huge. So that was one of the areas, and all the resources are there cited on the back page in terms of where this aligns with the Community Health Needs Assessments and some other resources from across the state. Second proposal was youth behavioral health and prevention. School-based health data, strong behavioral health service coverage, screening capacity linked with the school as a collaborative effort. So what are the youth crisis and text or chat resources if they exist? Regional youth behavioral health providers, patient and caregiver guidance sheets. I spent a lot of time in that area because I think, when you have a kid that's struggling, what are your resources?
Yep.
Prevention training opportunities, first aid, QPR, how to ask the questions. And then school LinkedIn access, so being able to partner with them. So that was one of the other areas. And then last was, and you discussed this really well, I think it was you, Tiffany, who sent that email in terms of I'd love to see the Broadwater County sort of snapshot about where we are.
Yeah.
So some of those things are, what did the Community Health Needs Assessment say? Are people aware that even exists? What mental health provider ratio? We are a high risk area because our access is so low within the community itself. What services are available for people, including and some of the statistics around that. So overdose counts, we do have a really small. With as small as our county is, we have a really small percentage of those, but it is not zero. So what does that look like? What are the things that we as the Board of Health are looking at and monitoring as an overview? Reportable condition education, so like flu, COVID, all that fun jazz. And then links to DPHHS, which include a broader scope of outside of even just the county, but also statewide. So
That's awesome.
Do you know if Megan is still doing this in-county resources for mental health? Is that I haven't seen a meeting for that in a while.
So, yes, she has been trying to get some education into the county, specifically to first responders and so like the sheriff's office and the EMTs. The one course that she has been
looking at and really wants to bring in has to be approved by the sheriff, and she's having trouble getting that approved. So we're kind of at an impasse. So we have been working on it, but we were just talking the other day about what else we could be doing. Because I personally think that we should work on.
Ruby, come up.
Oh, sorry.
Yeah, and will you let
I'm-
everybody know what Megan's actual title is? And she's grant funded, is my understanding.
So
for-
she's my medical assistant, but she also does our, I think, crisis coordinator is what the title is. And so essentially she is trying to bring in education because long and the short of it is we have a grant from the state for crisis diversion. The crisis diversion grant is essentially to be used for like educational purposes. Because we don't have the bandwidth in our community or like the logistical standings to do a like active crisis team in Broadwater County. So a lot of what she's been doing right now is like getting 988 out in the community and education on that front. But then she also would like to do some training specific with like EMT, the sheriff's office, that sort of thing. But like I said, we're having issues on that front. And then when I wrote the grant, was looking at more of community-based trainings, so that actual community members can learn some like QPR or mental health first aid, like skills that will help them deal with a crisis, either personally or like if your friend calls you in crisis and you have no idea what to do, like at least you can go over and be like, hey, like, let's sit down, take a breath, like, let's call 988, or, hey, you've been acting kind of funny. Like, just bringing more comfortability to the community members to kind of navigate crises on their own so that we're not inundating, like, the ER with a bunch of crisis calls, because our ER is not overly well equipped to deal with that here. And, Helena, there's been a lot of turmoil on that front for crisis intervention out of like St. Pete's and stuff. They have a really hard time with that as like the sheriff's office. And so I don't know what it's like as a private citizen, but like when the sheriff's office brings people, they have started bringing them to Bozeman because they don't have to sit with people and like stay there and be there, and the crisis team kind of helps take over in Bozeman better, is what I've been told. So that is kind of where we're at, is like figuring out what a good community-based resource would be. QPR is great, but I feel like it's done to death, and we've tried to do a community QPR and no one came. So I'm also like, what would people want to come to? And I was also just thinking about it the other day that we could potentially use some of that funding to get like a public speaker in the school too, to give out, to do more of like a youth-based one, because I know that a lot of our, maybe not a lot, but I know at least a few personal instances of like teenagers calling 988 versus adults in the county. So like making sure that they have those resources available to them too, and maybe having someone go in and talk more in depth with them about that would be a cool use of that funding that we have too. So
Great.
if you have any suggestions on what we could do classes wise, community wise, I'm more than happy to take them too, or you can contact Megan directly too. But
Yeah, I just knew we had that resource. I wasn't sure what.
yeah, and we have clinic space for Many Rivers. They haven't been down in a while. Their new outpatient, like their rural clinic coordinator, came down and chatted with us a while ago, and she, last I had heard, had a provider on the line that was gonna see rural patients, but I have not heard any updates on that in a hot minute. So
I have them on my list to touch base.
yeah, I don't know that they have had, if they were able to get that provider or what, but if there's someone struggling in the community and like doesn't have internet access, they're more than welcome to come do a virtual visit at our office too with Many Rivers. We have a private room and close them in there, let them chat, like whatever you need to do. So we try to be a good resource, but it's a little difficult.
Yeah, we have telehealth psychologists through the clinic, but
Mhm.
the availability is limited only a few times a month.
Yeah.
And then we have a VEL, and I know the sheriffs now have access to a VEL for like on-scene, in-home, like mini evaluation, safety planning, that kind of thing.
I think they've used it once or twice.
Mhm.
Like there hasn't been anything super crazy.
Mhm.
But the times that the officers have used it, they said it's been awesome. So
Yeah.
And that's grant funded right
Mhm.
now. I don't know what it's gonna turn into. Are you familiar with the VEL?
No.
Alyssa, do you know what a VEL is? You do, okay. Yeah, it's basically, it was grant funded.
through Many Rivers, isn't
Yeah,
it?
Many Rivers helped secure the grant, but it's a group, I think out of North Dakota, but they, like, the officers can show up in a mental health crisis, give them the tablet. People can talk right away to a mental health professional. They have follow-up stuff that they get scheduled with the person right away.
I think they're mental health RNs specifically. And so they do like all of the safety planning, all of that in the actual crisis. And then the follow-up goes through Many Rivers, and Many Rivers will reach out for like a provider follow-up or that sort of thing. So the times that they've used it, I've heard good things about it, but it just has not been used a whole ton.
I have 3 follow-up questions / clarifications.
Mhm.
So first off, if we've hosted, like, number one, I think getting in front of kids is going to be great
Huge.
because
Mhm.
that is a really high-risk area, but also if the kids are picking up some of these tools from school, you can bet that that's bleeding back out into the community. So I think
Mhm.
that's a fabulous approach.
Mhm.
The second piece is that if we hosted individual classes that were poorly attended previously, what does it look, does it maybe beg to consider, like, instead of hosting a standalone event, side tying into other events, like Fall Fest, rodeo, the bike road, like whatever the case may be, that we, that there's instead kind of an individual stand rather than hosting a standalone where we already have their captive attention. It's more of a slightly more passive approach, but better availability or access to the community.
Yeah, I think that's a great idea. And I know that one year our LAC did like 988 goodie bags at Slice of Summer, and it was like ice cream sundaes, and then you got a goodie bag that had like 988 and a VEL and all of the resources that we had in our community in it. And so like something like that would be awesome again. I don't know how we could do like an actual like QPR or something like that teaching, but maybe we could do like an invite, like having a booth and inviting people to a class or something, like getting a sign up list at one of those booths and just like, hey, if we're having one of these classes, would you be interested in attending? Like seeing if we can get names and numbers of people who would want to come and they can.
Is there any way to do like a QR code? So if you are at an event,
Yeah.
someone could scan the QR code and sign up right there.
Yeah, we could do that.
Could say like,
Um,
and then you have their information, right? And whatever.
Yeah,
database.
public health has access to JotForm. We have our own JotForm that we use for like our intake forms and stuff. But we use that for like the mental health teachings questions that we asked, like what people would want to see for trainings around town. So we could totally do a QR code for, hey, would you be interested in actually going to one of these, and put your name and number in. But we could do that at an event.
And then you have a list of people to contact right,
Mhm.
when it comes out.
Mm-hmm.
Maybe like, as we get into spring and summer and again, Fall Fest is one of the biggest events.
Mm-hmm.
And so as, like at the end of all of those, as things slow down in winter time, do we have the ability to be able to loop more people in? Is it timing? Is it like
Right.
summer where everybody's trying to cram an entire year's worth of events into the 3 months that we've got?
Yeah.
Is it, do we accumulate that information all, spring, summer, fall, and then as we move into winter, be able to host more opportunities?
Yeah.
that way?
Well, and we were talking about maybe seeing if we could do like a booth at public health or something at Slice of Summer, just as an informational thing. So maybe that's something I can put Megan on and get her working on like a interest sign up sheet, jot form, and then we could have one of us at Slice of Summer and just kind of be there to chat. And if anyone else wanted to come with us, that'd be more than welcome. Yeah, because we're open to whatever to make things work, and it's just been quite a process, and it's really frustrating because I wasn't ever going to get this grant. Like, I was not going to apply for it as public health because I was like, I don't have the bandwidth to manage this. And I got a lot of people who said they would help, and it's just not happening like it was supposed to. So it's a little bit of a point of contention in the world.
On an already painful and sticky subject.
Exactly. So it's really been frustrating.
The third piece I have, which may fall outside the scope of this discussion, but if there's feedback in terms of the availability or usability, feasibility of the mental health crisis team out of St. Peter's, that's information I would really like to have.
Oh.
That may fall outside the scope of this meeting.
Yes,
that's
but I can,
information I would like to have.
yeah.
I've got it for you too. No, this is great. I think if we can get Megan, because she's kind of granted for that, to utilize to help you, so it's not all on your plate. If we could get a guest speaker in the school, I think that would be huge, and it would touch a lot of these things. And then we could also follow up with maybe a parent meeting, like looking for suicide things for your kids, like start in the school with the same guest speaker that might be able to do something after school. So like you've got like this captive audience. And if the kids go home talking about it, you might get more parent involvement. Yeah, and I know getting into the school has been a touchy subject in the past as well. So maybe with Cammie in the school, she could put in a good word for us, because Cammie used to work at public health, so she's pretty pro public health, very helpful. And I heard the new superintendent, right? That's what we have. That's Brad. I heard he's great.
He's great. That's awesome.
A lot easier to get in. So I think it's worth another shot with the school.
If I may, these are awesome ideas. Do you see, like, on our website's pretty plain. I'm going to talk to Ken, see what we can put on there. Because, I mean, if we can use it as a resource, do a QR code, do something that people can access, that's great. Do you see having these almost like, like sections on the site, tiles, informational?
That's totally going to be driven based on the capability of the website.
Right, okay.
That's completely going to influence how, like, any of what we add is structured.
Let me see what we can do. I'll let you guys know, and we can kind of decide what should go in there. I love your ideas, but I will let you guys know, and then you can tell me what you want to try and put in there.
Yeah.
That works, okay.
Cool. All right. Resources, grants, funding, I think is our next topic. Do we have anything on that? No.
In particular. Grants, I mean, I had passed on some information that I had researched pretty quickly. I don't know what we would need as a board and a grant for at this point in time. So I think maybe when we have more of an idea of what if there is something that we're trying to do that would be reasonable. But grants are a whole thing. You've got to manage the grants and do deliverables with grants, and there's a lot to it. So, as Ruby knows.
Yeah. And that would need to go with commissioner approval, I'm assuming, since we're board. Okay. Any other roundtable discussions? No?
I'm really excited that we have new members and people that are, we had great members before too.
We did.
But it's nice to.
They were all members through COVID, so I just think it was.
Yeah, it's a lot.
After that, everyone was ready to be done.
Right.
But I think that's what I took away from the Confluence last year, was that there's a lot of things boards of health can be doing. And obviously it's like when COVID was happening, it's high demand board of health, but when it's not happening, okay, what are we doing? What are we trying to accomplish? So
Set ourselves up so the next COVID's not quite as bad.
Yeah,
That's what we're doing.
exactly.
Exactly.
We're not doing that again.
No, we're not.
Nobody wants to do that again.
All right. Well, with no other discussions, I take a motion to just adjourn the meeting.
Next meeting, sorry.
Oh, next
Next
meeting.
meeting.
March 16th, 3 p.m. Work for everybody?
I'm supposed to work that night.
Oh, somebody should talk to your boss.
Right.
Sorry.
I'm good with that day. Not that I'm good with that day. Make it work for you guys.
If I can just join on Teams or something.
Yeah, you can join on Teams.
I'm awake by then. I'm just not in town by then.
Right. Right.
I am free and clear that day.
I got nothing. That is the weirdest thing. I have Board of Health on March 16th. Let's do it.
All right. Look at that. Look at you.
It has to actually happen first, though. Don't get too excited.
I know.
Okay. You're here to keep me in check. You can't leave me now.
Who's here?
You.
No.
All right. Any comments from the floor? Nope.
Remember, we have to sign this.
I will sign that.
You guys have to sign that.
Board of Health. All right. Motion to adjourn the meeting.
I move to adjourn.
Perfect. Second?
Oh wait, I
Second.
can't. I can't vote. Sorry. It's got to be
All
guys.
right.
I move to adjourn.
It's going to be a hard
Second.
habit.
I know.
All right. Meeting
You're
adjourned.
so excited there. Tell
She's
us
like,
you love